Question number 1. 10 years ago, your paper, Why Most Published Research Findings Are False, focused attention on a serious problem, or at least what I consider a serious problem in scientific research. How would you summarize this problem for non-experts?
So the paper tried to look at the big picture of how common it is when we make a new discovery, claim something that is a significant finding, for that finding or that discovery to be true and not to be refuted down the road or found to be grossly exaggerated. And there were some empirical data that had started accumulating from evaluations that looked at the replication patterns of different types of research, and some of the signals were very worrisome. So the paper tried to put together a mathematical model to see what the expectations would be under ideal circumstances and under probably less than ideal circumstances. And the conclusions were that it's very common in many scientific fields operating with some particular mode of designing and implementing and reporting studies to see a very large number of false positive claims. And in many cases, one would expect to see the majority of the claims or discoveries and significant results to be just false positives, not real things, but red herrings or just the result of bias and random chance.
Could you recount for us a little bit about the initial reaction to the paper? So maybe from the colleagues around you, or the first seminars you gave on it, and then later from the broader community?
So I think that the initial reaction was not necessarily negative, although some people questioned whether that is indeed the case. I think that overall the paper was well received even early on, and I think that there was increasing momentum building over time, with more people interested to take a look at the bigger picture rather than just single studies, which is what all scientists are doing, including myself, for a very long time. And I think that since then there has been a lot of very interesting discussion and contributions, both in terms of theory and observations and empirical data for replication patterns in very diverse fields, both in biomedicine but also beyond biomedicine.